My name is Insa Schmidt. I'm a physician scientist at BUSM and BMC, and I'm here today with Dr. Merav Shohet, who is assistant professor in the Department of Anthropology at BU. So we aim to combine our research interests in issues of care and biomedical practice, and designed this study to better understand the psychological and macrosocial dynamics that may shape disease trajectories of patients with chronic illness, focusing on our patient population with advanced stages of kidney disease at BMC. So we hardly need to tell this audience about the many harms our society inflicts on poor and especially racialized people of color. But this is also very much reflected in kidney disease and COVID-19 epidemiology. So Black and African Americans accounted for over 30% of COVID-19 related deaths at the beginning of the pandemic. And similarly, they are also disproportionately affected by chronic and end-stage kidney disease, requiring lifelong dialysis treatment or transplantation. And you see the overlap between these two conditions also illustrated in this pie chart of our study at BMC, where more than 60% of patients with advanced stages of kidney disease who lived in areas highly affected by COVID-19 were people of color. And so these epidemiological data show what is syndemics par excellence. So then the impact of one and usually more adverse conditions interacting with one another produces exponentially magnified harmful effects.
So thinking about this connection between the biological, the social, and the psychological, we also use the model of syndemics to conceptualize stigma as a social determinant of health. And so we're studying how COVID-19 interacts adversely with end-stage kidney disease to leave patients especially vulnerable to stigma in the US, since self-reliance, autonomy, and hard compensated work are mythologized and valorized here as constituents of the good moral life. And so we conducted ethnographic interviews with 20 patients, including 9 women and 11 men, ranging in ages from 37 to 85 years old. 18 were Black or African American, 1's Latina, and 1 is Asian American. And we've just completed the data collection phase. And so we're analyzing the data using grounded theory and narrative dimensional analysis. And as we expected, the patients face a range of stigmas, although they most often didn't speak about them in these terms. One stigma has to do with getting recognized, since kidney disease is invisible. Another involves job loss, since dialysis is literally draining, and it makes it impossible for 90% of our population to work due to that, and also to health and age concerns. Finally, there is racism, and especially men in our study were quite open about their race-related suffering, including being marginalized, disrespected, harassed, beaten, and incarcerated. Still, our patients didn't describe the pandemic as a straw that broke the camel's back, but they spoke about COVID-19 as just one more thing to adding to their long litany of troubles. And so thinking about flourishing, is our story all about gloom and doom? Well, sort of, not exactly. Many patients clearly point to systemic societal ills, especially racism, that overdetermine their poor social status. But they're so drunk in the American message of individualism that when it comes to their ill health, they claim individual agency and self-blame. For flourishing, many of them talked about supportive family and friends, and almost all of them talked about prayer, faith in God, and attending church, even on Zoom during the pandemic, when we asked about what keeps them going. Obviously, with this small sample, we can't make any grand claims, but we do want to investigate more about how their communities, the family networks, handle stigma in patients on dialysis. And we plan to develop a validated survey instrument to assess the psychosocial consequences of stigma and stigmatization in patients with kidney disease. And I guess to close, we're just really confident that prescribing more prayer or more family and friends as neoliberal individual remedies are not really good solutions, but really systemic social change to prevent syndemics in the first place would be what would enhance flourishing. Thank you.